The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Welcome to Health for a Lifetime. I'm your host, Don McIntosh. Today we're going to be talking about a very interesting subject, something we haven't talked about before on this program, vitamin D. And here talking with us about vitamin D will be Dr. George Guthrie. Dr. Guthrie, you're a physician at the Lifestyle Center of America in Oklahoma, isn't that right?
That's correct.
You also were in family practice. How many years were you involved in family practice medicine?
About 14 years.
And you've been a professor at Loma Linda. You've taught about health, and you're a nutritionist.
Yes.
Also, I think you're a carpenter, aren't you? Many different things. We're glad you're with us today, Doctor. We're going to talk about vitamin D.
Yes.
What is vitamin D?
First, vitamin D is not a vitamin.
Well, why do we call it vitamin D?
Well, that's kind of how the history came to us. But vitamin D is actually a hormone.
You are Dr. Guthrie, aren't you?
That's correct.
Okay. But vitamin D is not vitamin D.
Vitamin
it's a hormone.
D is made in the skin when sunlight hits the skin. And vitamin D is actually created in the skin from cholesterol. So the radiation from the sun hits the cholesterol in the skin, and it changes the cholesterol actually by breaking one of its four rings into a pre-vitamin D.
So one way to lower cholesterol that kills us is to go out in the sun.
Well, you know, I've thought of that, but I've never seen any documentation that it works directly that way. The amount of cholesterol used, I'm sure, is small compared to the total in our body. But it's a good thought.
Okay. So vitamin D, what does it do in our bodies? You say it's a hormone, but what does it do in our bodies?
For years, we focused on vitamin D's effect on the calcium balance in our body. You see, our body needs to have the calcium level in the blood very carefully balanced. If it gets out of balance, all kinds of funny things can happen. Nerves start firing when they're not supposed to. Heart gets irregular. The calcium level in the blood needs to be kept stable. And vitamin D is an important part of the complex of several hormones that actually manages that calcium level.
So vitamin D is in charge of the calcium.
That is one of its important jobs.
And if it doesn't do that, then the body gets all upset. What can happen if the body gets upset? What kind of things happen?
Well, tingling around the mouth, carpopedal spasm.
Which is like your hands?
Yeah, muscles go into spasm. The heart can beat irregularly.
This is with calcium out of whack.
With calcium out of whack.
Okay, so someone watching today that has that happening, what should they do? Get out in the sun immediately, turn off the TV. You've watched too much 3ABN, right? I don't think that's possible to do. But so what kind of diseases then are associated with low vitamin D?
Let's wait to pick up the other side of the other job, because it's relatively new in our understanding.
So it monitors calcium, but
it helps to balance the calcium, but there's another important job that it does, and that job has to do with something called terminal differentiation.
Boy, that sounds like something we want to do at the end of the program.
Yes. Let's talk about the word.
All right, what's it mean?
When you understand it, it's actually pretty exciting.
Okay.
You see, when you were in your mother's stomach, you started out as one cell divided into two.
I don't remember this.
I know.
But, yeah, okay.
I don't either. Divide to 4, 8, 16. Somewhere along the line, one of those cells was going to turn into a heart. And it grows, splits, divides, grows until it finally gets to be heart size. And when it's heart size and it's doing its job, it is said to be terminally differentiated.
And vitamin D sends that signal, or is involved in the sending of that signal?
It's one of the strongest terminal differentiators we have. Our body uses that apparently for this terminal differentiation process. It actually goes into the nucleus of the cells to make this modulation. Oh. In its other form, it works more in the serum, in the fluids around the cell. But this one form of it that actually goes into the cell.
So it's vitamin D, and the D stands for done. That's done, right?
Okay, the terminal differentiation, it's finished, it's done, it needs to stop growing. Now this becomes even more interesting when you recognize that cancer is the loss of terminal differentiation.
Okay, so it never gets done and makes a tumor.
Right. Cancer that loses its control starts to grow out of control. It loses its terminal differentiation, and in essence, that is the definition of a tumor or a cancer. More about effects of that later, but there are some associations with vitamin D deficiency and some cancers.
Wow, so this is a very essential hormone, not a vitamin, vitamin D.
You're learning, Don.
And it's something that we get from having exposure to the sun. You're going to talk more about, I think, where we get vitamin D at the end of the program, but what about some of the things it causes? What does it lead to if we don't have terminal differentiation, or it doesn't get us done?
You have the calcium imbalance.
Or calcium in balance. What can this lead to?
The first disease process that really brought vitamin D, the knowledge of vitamin D to the surface, was this disease called rickets. The bones need vitamin D to absorb the calcium and to help put the calcium in the bones. If there's not enough vitamin D, the bones are very soft. This is very common in children and really became apparent during the industrial age. Children living in tenements, very narrow streets, no sunshine, developed very thin bones. They tended to have bow legs, rickettsial rosea. If you look at their ribs, it has little bumps along the edge of the ribs as the body was trying to make bone and couldn't.
It didn't have the vitamin D.
Right.
What else? Osteoporosis?
Osteoporosis, osteopenia, the thin bones in adults are also a problem, and the whole issue of osteoporosis in older age is made worse if vitamin D deficiency is present.
What else?
Well, it's been of interest. There's some strong evidence that psoriasis, that flaky, silvery type stuff that comes on elbows and knees and scalp, may be related to vitamin D deficiency. This makes sense if you understand that psoriasis is cells that are growing too fast. Vitamin D helps with terminal differentiation.
I see.
Some of the new medication they have available, some new cream that you actually put on the psoriasis to make it go away, is simply a vitamin D
topical type
vitamin type of a cream.
And they could just go outside.
Yes. As a matter of fact, for years, that's the way psoriasis was treated.
Yeah.
I remember in my training visiting the dermatologist's office and seeing a box. People took their clothes off. They got into the box. They turned on these bright lights that had the right radiation, and people would get treatment for their psoriasis.
And when they, boy, so I guess in a place like a Scandinavian country or Alaska or something, you really need the box, but if you're at home, you just go outside.
The sun is always there. I mean, we've known for years that sun helped that as well.
Now, one of the things you said is it causes hyperparathyroidism.
Okay.
And then what does that mean?
Oh, man.
I mean, hyper, I know what that is. I mean,
hyper is high. Parathyroid hormone is another one of the hormones involved with the calcium balance.
Okay.
Vitamin D and parathyroid hormone work together along with some other things to balance the calcium.
That's up here somewhere?
Yes. It sits in the thyroid gland, little nubbins in there.
So when that thing gets big and overactive...
If you don't have enough vitamin D,
okay,
instead of being able to get the calcium from the food you eat, your body has to turn to taking it from the bones, and the parathyroid hormone tries to get it out of the bones. So if that goes up, it causes all kinds of problems. The calcium gets out of balance a little bit. The bones tend to get thin. I've got a list here. Okay. Hyperparathyroidism.
Thirsty?
When there's not enough vitamin D. Thirst, urinating a lot, ulcers, pancreatitis, constipation, vomiting.
Boy, that doesn't sound like a good list.
Not good. Fractures, joint and muscle pains, gout, calcifications, fatigue, apathy, anxiety, depression, coma, hypertension, and other heart difficulties.
All these different things because it's trying to get what it needs from the body. In other words, it needs the vitamin D from the sun. It's not getting it. It's not being turned into it. So it says, I'll take a little here, and then it just messes up everything.
It messes up the system. And the strange thing is, this is a hard disease for doctors to diagnose. You heard as I read that list, those are symptoms from a bunch of different diseases.
Yeah, if someone's thirsty and they're going to the bathroom a lot, you might think they're a diabetic.
Right. Tired, fatigued, maybe your thyroid's a little low. It tends to masquerade as a lot of things. One of the things I was taught in medical school was, if you don't think of it, you'll never diagnose it. And try to keep this one up in the front because it happens. And much more frequently, it appears, than what we had thought.
So vitamin D, put it on the radar screen.
Put it on your radar screen.
And if someone's sitting here in front of the cameras like we've been doing for this program, and maybe some people do this all day, I don't know, around here, could they be in danger of not getting enough vitamin D? You can't get vitamin D from these lights here, can you?
Your body will make vitamin D from anything that can cause sunburn.
Oh.
Okay.
Yeah.
So if these lights are so bright they actually cause sunburn, you're probably okay. That would mean that people who went to tanning booths could actually make a little vitamin D, right? That would mean that when you went out in the sun, you could make vitamin D.
Yeah, I think I know what we're going to do on the break, though. As soon as we get through with this program, I think we should go out in the sun. Now, on your list here, I have it says diabetes type 1.
Yes, vitamin D deficiency is associated
with that?
With type 1 diabetes, but
How?
it's probably not a cause.
Okay, not a cause.
It probably works by helping the immune system keep in balance so it doesn't get confused. Type 1 diabetes is what we call an autoimmune disease where the body turns around and fights itself. And so if it's fighting the beta cells in the pancreas, it's doing the wrong thing. Vitamin D tends to help the immune system stay in balance. That's probably the association.
They always talk about the 3 big C's: cardiac, cerebral vascular, in other words, stroke, and then cancer. You've also suggested here that there are studies that show that vitamin D deficiency is related to certain types of cancer.
Exactly. Very interesting study done by Garland. It reported in the literature several years ago, looked at several thousand people over a period of 7 or 8 years, looked at their rate of colon cancer, and tried to predict or see what happened in relationship to their vitamin D levels. And in essence, there was a 80% reduction in the colon cancer rate of people who had high levels of vitamin D versus those who had low vitamin D levels. This makes sense, and it's kind of an up-and-coming area of study in the scientific community. There is a study going on right now in Canada looking at prostate cancer and vitamin D levels, ovarian cancer, breast cancer, lymphoma, leukemia. These cancers seem to have a vitamin D link.
Is there any danger from getting too much vitamin D?
Boy, you sure can. Too much vitamin D, vitamin D is one of the toxic vitamins. We talked about low vitamin D causing problems with pulling calcium out of bones and causing a bunch of symptoms. When your vitamin D is too much, it starts to pull too much calcium in from the intestines.
I see.
So many of the symptoms are similar.
I see.
They're high calcium levels. So the symptoms from high vitamin D levels are similar.
Let me come back to that. But, you know, other things then that are risk factors, those that have low vitamin D, multiple sclerosis, you have something, you've talked about that. How's that related?
Okay. There was a recent paper in January of 2004 that reported an association between low vitamin D levels and multiple sclerosis in women. So we don't know that it's a cause-effect relationship. It may be the immune system again, but we're finding these associations, and I think over the next few years we're going to find out a lot about the importance of vitamin D.
We need to go to a break just in a minute, but are there certain people that are really at risk for having vitamin D deficiencies? In other words, not too much, not enough vitamin D.
Yes, there are. We've been actually at Lifestyle Center of America measuring people's vitamin D levels when they come in. I am amazed at how many people are actually vitamin D deficient.
And what types of people do you normally see?
Well, we are seeing generally older people, but younger people as well. People who are more likely to be indoors, for example, not out in the sun all that much. So
babies?
We don't see babies at Lifestyle Center of America. But I haven't looked at the data in detail, but it appears to us that around 50% of the people that come actually have a vitamin D deficiency. It's much more common than we might think.
And it can really cause problems, but there's a solution, right?
There is a solution.
We're going to talk about that solution when we come back. We're talking with Dr. Guthrie about vitamin D. You need to join us after the break.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Deal and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Deal and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We've been talking with Dr. George Guthrie. We've been talking about vitamin D and its importance in, actually to you and your body. And as we've been talking with Dr. George Guthrie, we've learned some fascinating things. Dr. Guthrie, what are the things, again, what are the real reasons we need vitamin D?
Vitamin D has two major functions. One is to help the body balance the calcium in the blood, and the other is this apparent terminal differentiation to help cells decide what they're doing and stay there.
All right, so terminal differentiation just makes sure work as long as you're supposed to on that project and then you're done with it.
Right.
And then balancing the calcium again, why is that important?
Because if the calcium gets out of balance, the body tends to get thin bones, nerves don't act right, heart gets irregular.
All those diseases you mentioned.
That's right.
Okay. Well, are there certain people that are at risk for this? I mean, how do you develop this deficiency?
Since vitamin D is best obtained from the sun, people who are not in the sun or don't get very much sun exposure are at greatest risk. A lot of people are surprised to know, for example, that sunblock with an SPF of 8 will block something like 98% of the vitamin D formed in the skin.
Well, they do that because they don't want to get skin cancer.
Exactly. And that's been kind of the pull back and forth. Doctors are saying, don't get a sunburn. Don't
Right.
spend too much time in the sun because you'll get skin cancer. At the same time, we also need the vitamin D. So it's a tension. Maybe the best way to deal with it is to say, or to recognize that vitamin D deficiency may increase your risk of cancer. Too much sun to the point of actually causing a sunburn will increase the risk of cancer. So maybe we need to find a balance somewhere in between.
So put it on an hour after you've been outside or something like that?
Well, the rule is don't burn. And you
Okay.
know, some people have a very sensitive skin, and in 5 minutes they'll burn. So it would be reasonable to not put on your sunblock until you've been out in the sun till it's just pink. We call it the minimal erythema dose.
The minimal erythema, which is the pink.
Just pink, not burn, because when you burn, the rays, energy from the sun has actually overpowered the protective mechanism of the cholesterol to vitamin D and damages the DNA and protein, and that puts you at risk for the skin cancer.
Okay. What about if any older or younger? Well, let's say an older person.
Older people have a harder time making vitamin D. The enzyme in their skin that prepares the cholesterol to turn into vitamin D doesn't work as well. The numbers that are thrown out is 75% of people, there's a 75% decrease in function of that enzyme by the time people are 70 years of age.
Okay.
So there's some risk from just getting older.
So when you're old, are you just doomed?
No, you better start looking for some other sources of vitamin D. Let's talk about that just a little bit later.
What about someone, you mentioned you have to be pink, but what if your skin is naturally black? You're an African American.
African Americans are at high risk. Estimates are that 50% of black Americans in this country have some vitamin D deficiency.
Why is that?
Well, the pigment, the dark pigment in the skin, blocks those same rays.
I see. So that's
And
like
it never makes it to the cholesterol to turn it into vitamin D.
So what should they do?
That's a real good question. Spend more time in the sun, 7, 8, 10 times as much time in the sun necessary for the very dark-skinned people to make the same amount of vitamin D. Or they may need to take supplements, but let's talk about that when we get to the end.
What about someone that's young?
Young. We discovered vitamin D in relation to rickets, which was a problem with children.
Thinning of the bones.
In the old days.
Okay.
Now we know about vitamin D, but you know, kids aren't playing outdoors as much as they used to. There's a lot of the video games and that type of thing. So a significant number of children are actually coming up with rickets these days. And in the pediatric literature, we're reading about more and more cases of this vitamin D deficiency.
Okay, and it's not so much the calcium then as it is the vitamin D side of that equation with the rickets.
Right.
Okay. Then what about someone that's overweight?
Now you bring up a very interesting point. People who are overweight, number one, don't like to go out in the sun. Often they'll have joint pains. It's just not very flattering to put on a bathing suit. So they often avoid the sun. But besides that, vitamin D is actually a fat-soluble vitamin, meaning when it gets into our bodies, it distributes itself in the fat. And so when someone is large, they have has a lot of fat.
A larger distribution
They
base.
have a larger container to fill with the vitamin D.
So
they are going to tend to need more vitamin D to keep that full, that container full.
So one way to help that is to lose weight again.
Okay, if there's less fat, that's true.
Okay.
There would be a little less need for vitamin D. But I wouldn't wait for somebody to lose weight. I would want to replace the vitamin D.
We talked about the young and the rickets with the young, but what about the really young, like the babies?
Babies, good point. You know, when we've been taught that in this country, we get our vitamin D from milk. The cows do not put vitamin D in the milk. That was a decision of the public health people of the country to solve the rickets problem by adding vitamin D to dairy. Breast milk does not have vitamin D in it either.
It doesn't?
It does not.
Even if the mother's out in the sun?
Even if the mother's out in the sun, there's no vitamin D in the milk. So when the baby is breastfeeding, they will not be getting vitamin D. There are some doctors who are recommending that when a baby goes home from the hospital, actually receive a shot of vitamin D to hold over for those first few months till the baby is actually exposed to a little more sun. You know, in the winter, especially a baby is wrapped up tightly and kept warm because they're small, they often don't see enough sun to make vitamin D.
So if you live in a country you're watching this program and there's not people that can give you a shot, though, and you have a baby, what do you do then? Take them out in the sun?
Oh, boy, Don, I don't know that I have a good answer to that. I think I would have to look for oral supplementation.
Well, what about fibromyalgia? I mean, you talked about, what was it, hyperparathyroidism and how it masks itself as different things. And fibromyalgia has all kinds of symptoms. What's the connection between that and vitamin D?
The symptoms of vitamin D deficiency can be, in some individuals, very similar to fibromyalgia. Now, fibromyalgia is not a distinct and well-recognized symptom complex. We don't know what causes it. It probably has multiple causes. It looks like some of the people with that diagnosis probably have vitamin D deficiency. And there have been those who have had the diagnosis of fibromyalgia who have had their vitamin D replaced orally in the sun. Over 2 to 3 months, the fibromyalgia kind of melts away. It's not true of all of them, but I think it's an important thing to be checked if someone has the diagnosis of fibromyalgia.
So it's certainly worth checking out.
Yes.
And, especially if you're suffering from that. We have about 5 minutes left to look at. I mean, you've convinced me, all right. Vitamin D is very important. It's associated with all kinds of risks if you don't have it. We have a few more minutes. Can you get too much vitamin D? And then what are some good sources of vitamin D?
Okay. Vitamin D is actually a potentially toxic vitamin. And if we get too much of it, it causes symptoms that are actually similar in some ways to those of low vitamin D. See, when the vitamin D is low, the body pulls the calcium out of the bones and tends to have too much in the blood. When the vitamin D is too high, it absorbs too much calcium from the intestines and tends to mimic some of the symptoms.
I see. So how much is too much and how much is too little?
Okay, that's a good question. If we're measuring blood levels, we know there's no toxicity until the blood level is over 150 nanograms per deciliter. Now, I know those numbers are kind of hard. We're going to throw them up on the screen here a little bit later so you can get a better feel for it.
Okay.
Deficiency probably occurs when the level is less than 30. There's evidence, for example, that levels up to 30 have some parathormone elevation or parathyroid hormone elevation. So it would be good to have people's levels over 30. Personally, from my understanding of the studies looking at cancer, I think 40 or 50 is probably a better dose.
So we need about 40 to 50. We can figure this out with a simple test at our doctor or something if we have any questions about vitamin D deficiency.
This is a blood test that is done. People who, the beach bums that spend all day in the sun will have levels up to about 100.
Okay.
So that's a rational level.
All right.
So that's kind of where we like to aim as a doctor.
We have a graphic that shows recommendations about where to get this, so maybe you can work us through that.
Okay. On the graphic, you'll see that anything less than 20 nanograms per cc or milliliter is too low.
Okay.
That's what my laboratory says. Although their normal values, if you look at the normal, taking the curve in the population, is 8 to 60. Anything below 20 is showing evidence of being low.
And you want it between 40 and 50 is the goal.
I'd like it between 40 and 50 to maximize the beneficial effects of vitamin D.
And the beach bums are up to 150, and that's okay?
No, they're up to 100.
100.
If you get above 150 from taking too many supplements, that could cause symptoms. There are no symptoms as long as the level is less than 150 nanograms per milliliter or cc.
Okay, do some people need more vitamin D?
We've talked about, in essence, the size of people. If they're larger, they have a larger container, they'll need more. No, I don't know that lots more, but the recommended daily allowance changes to reflect what we've talked about with older people.
Right.
It starts out about 400 international units a day and is now moved up to 600 international units a day for the elderly.
So how much sun then should we get a day? I'm convinced I need to be out in the sun more. How much should I be out?
If you do the calculation from getting kind of pink all over and how much vitamin D you make, it looks like you need about 15 minutes a day with your hands and wrists, head and neck exposed.
15 minutes a day. I think anybody listening or watching can do that 15 minutes a day.
It's not a hard goal to reach. One warning, above the 35th parallel, you do not make vitamin D in the winter time. So it would be reasonable to use oral supplementation during the winter time in people who live to the north.
So then how much is safe to take?
We know from scientific studies that 1,000 to 2,000 international units a day for adults is a safe level.
And they can get this in a pill form?
Yes.
Okay.
It is a fat-soluble vitamin, so it's absorbed better if it's taken with a little bit of oil.
So let the sun shine in is the message today, and if you don't have the sun, get those some kind of supplement as you listen today. We're glad you joined us and hope that you have health that lasts for a lifetime.